One of the grave concerns that and I think many other people have, is that this crisis will finally, unequivocally, expose the vulnerability of our National Health Service. You know, we've talked about waiting lists, we talk about the diminishing number of beds and the diminishing number of staff. We all know that it's been drastically underfunded and under-resourced for years and years and years. And now, suddenly out of the blue, it's going to be exposed to something which it's going to struggle to deal with. And there's every likelihood that it will buckle under the pressure. And of course, this will cause enormous embarrassment to our government, who has long said, no, everything's okay, we're giving them more money, we're not worried about people from the EU coming to work in our NHS, the doctors are all great, as they are, but we haven't been paying them enough, have we, to keep them there? We haven't been making those investments, and I think they're probably terrified of the nation's baby, the greatest institution that we have in the UK, a health service designed to look for free after everyone, collapsing and folding under this pressure, and finally exposing the fact that they have done everything they can to destroy it. And of course that would be a tragedy on many accounts. An indication of the vulnerability of our health service is that the government are now asking if anyone can make ventilators. I wish I could. I wish I could go into my garage and in Blue Peter style get some toilet rolls and some sticky back plastic and come up with a ventilator to keep someone, a vulnerable person, alive. The simple facts are that we should have been investing in ventilators for years and years and not squandering money on highly expensive aircraft carriers and other insane foibles of the 21st century. This crisis is going to expose the fact that our National Health Service, the nation's baby, one of the most precious things we've got, the greatest institution that we've got in the UK, has been left very, very vulnerable. And at this point in time, my and millions of other people's hearts go out to those people working in the NHS who are going to be doing everything they can to keep our nation healthy. But sadly, they're going to be struggling through lack of resources. We salute them, we love them, we respect them. But now, I think we're going to be all left feeling extraordinarily sorry for them in this time of crisis. In the contemporary world, it's becoming, sadly, increasingly difficult to find integrity, honesty, and truth in news. But the one place you can find it is on Double Down News, and therefore I would urge you to sign up on Patreon now.